ELPA is a European Liver Patients Association, which is basically umbrella organization today with 35 members, national organizations from 27 countries, not only from Europe but also from the Mediterranean basin. For instance, we do have our mission is, basically our vision is a world without liver diseases. And we would really like every single patient with liver disease to be treated on time with the best drugs and with all respect that as a patient needs. For the first time ever, World Health Organization has adopted and produced global health strategy on viral hepatitis. So this is really the very first step. Of course, this is not the end, this is just the beginning for us patients. What World Health Organization said back in May when the strategy was adopted? They said, okay, we will set the monitoring system the target is to set it in 2018. Well, to wait for 2 more years for us patients, for some patients who are at the end stage, they will not even be alive anymore. That's why we decided to do something proactively and, to try to help to World Health Organization, to experts, to governments, to help them with our study and with our research. Now we have a tool.
What is Hep CORE Report? How did you came up with this report, and what are the main results?
Well, the Hep CORE Report was commissioned by the European Liver Patients Association, and it's the first European monitoring tool to understand what viral hepatitis policies are in place in countries across Europe. So working with the patient associations in each country, we analyzed all of the different policies related to hepatitis that could be in place in a government, asking if they're established, if they're going to be established, and how we're doing country by country throughout Europe. And the results are very telling. We asked a question about, starting off, do you have a strategy for viral hepatitis? Half the countries do not have a strategy. Do you have an action plan? Do you have a national registry for hepatitis B or for hepatitis C? And so on and so forth, to try and get a full understanding of the hepatitis policy situation in each European country.
In Europe, viral hepatitis B and viral hepatitis C affect approximately 25-30 million people, with an attack rate of either hepatitis in the range of more than 500,000 per year. There is a difference in terms of endemicity, meaning that hepatitis B and hepatitis C are prevalent in the Mediterranean basin countries and the Eastern Europe countries with respect to the Central and Northern Europe, where, however, most of the cases of viral hepatitis are bound to parenteral risk behaviors, lifestyle factors, in other words.
In May, it was decided on a global level how to eliminate hepatitis from this earth. And now the member states are urged to set up strategy plans and develop their own logistical solutions to eliminate hepatitis B and C out of their countries. Then we need targeted strategies to find them. The diagnosis rate needs to be improved. Third step is, of course, to offer treatment. So that means all countries are asked to offer free access treatment from the latest development of the drugs that is possible. And then, of course, monitoring of the process and reporting back to the WHO. This is a process of the WHO that has been confirmed by all the member states worldwide.
Leading organizations came together. They released a manifesto together with patients, advocates. One of the main findings is that most countries do not have a strategy to address viral hepatitis. And that's in spite of WHO passing its own strategy this year and calling all governments to develop a strategy. Another key finding is that prevention for hepatitis is severely lacking in many countries. And that means prevention among healthcare workers working in public institutions, but also harm reduction for people who inject drugs. That doesn't mean that some countries aren't doing well, but many countries are not preventing hepatitis.
Prevention of viral hepatitis is based upon a number of measures. First of all, hepatitis B is efficiently prevented by mass vaccination of newborns, which is in place in the vast majority of the European countries. In Italy, people ranging between 0 to 35 years of age are covered by the vaccine indeed. As far as hepatitis C is concerned, screening of blood and harm reduction policies to prevent spread of the virus among the PWIDs and the inmates have been proved to be very effective in this regard. But of course, WHO has already launched a program, meaning that by 2030, both viral hepatitis B and C should be eliminated. To achieve this goal, we need, first of all, to understand exactly how many patients are infected and where is the burden of viral hepatitis in Europe. So we actually need to have a campaign of screening, nationwide screening in each of the European countries.
On the one hand, on a global level, in a meeting of the WHO member states, all Ministries of Health has confirmed and approved, okay, we start the elimination process. But out of the Hep CORE project, you can see very good that in the WHO Euro region, so we have only half of the countries that have a strategy plan. And out of this, these countries are not able to achieve any of the targets they have confirmed. So on the one hand, the minister is saying, yes, we eliminate, but then the minister is going back to his country without any plan. That means there is no screening, there's no access, and that means that every day 400 people die because of hepatitis, because of inactivity. That means every year around 10 million new infections appears, because there is no plan.
We are committed to fight against viral hepatitis. And now it's time to act. And with this study, we can tell them, okay, here we have a gap, and here we can do some improvement.
It promotes the recognition of hepatitis as a core challenge to be tackled. The Hep CORE study being launched today is a real turning point in Europe. Now we understand what policies are in place and what policies are not in place. So it's a time to take the report, read through it, read about your country, read about the other countries, and plan the action that needs to happen in 2017. And this action needs to happen not just from the patient groups who were involved with the Hep CORE study, but from governments, from clinicians, and other key stakeholders.